mamas, welcome back to the channel. Today I have an amazing video for you guys. It is what to pack in your hospital bag for the baby. I am so excited to bring you guys these top 15 things that I feel like you are going to need as a labor and delivery nurse. I have seen so many of my clients say they love these things. So many of them be like, I forgot that. I wish I had that. So I am going to be bringing all of the things that I think you are going to need during your postpartum stay with the baby and a little bit after delivery. So buckle up because we got a lot to talk about. So let's get into it. Coming in at number 1 is going to be mittens. So babies have the thinnest little fingernails, but they do damage. They scratch themselves all the time. So you want to have some type of mittens on their hands. And also their little hands and feet are the last things to kind of get perfused. And when I say perfused, get blood flow. So sometimes you can see they're kind of like a little purplish after delivery because they get super cold. So, and they're like the last things to get perfused. So little mittens will also keep them from scratching themselves and keep them warm. So do not forget your mittens. Coming in at number 2 is going to be swaddles. So all of my patients love for me to swaddle their babies, and I love giving them tutorials on how to swaddle their babies. But very few of them get it down packed because it is a skill. It took me like a month when I was like a new grad to learn how to swaddle a baby. Years later, I could do it in my sleep, but it took a while. And you don't have time for that when you have a newborn, you're trying to get the baby to sleep. You don't have time to be learning how to swaddle. So what I really recommend is bringing the fake swaddles, the ones that either zip up or they Velcro across. Bring them. I'm going to be showing you guys a lot of different examples on the screens, but bring them so that it makes it easier for you. You don't have to swaddle like us. Just bring what's going to work for you. Most babies love to be swaddled. We usually call the first month after delivery the 4th trimester. So babies really want to simulate what happened in the womb. And in the womb, they were very tight. That's why they love swaddles so much. So you probably won't have time to figure out how we do the swaddles at the hospital, but if you bring the little zip ups, or I call them the little stray jackets, if you bring the little Velcro ones, the little stray jackets, you will be fine. They will love it just as much as if your nurse was swaddling your baby. Trust me. Coming in at number 3 is going to be a nail file. So most of my parents ask me, can they cut the baby's nails? And that is a no. Right after delivery, their nails are very thin, and sometimes it's still sticking to the skin under their nails. So we do not want you cutting their nails because you could potentially cut them. So we don't want any of that. What you can do is file their nails. So really like being very careful in filing their nails, but we do not recommend cutting them. So you want to bring a nail file so that they don't scratch up their cute little faces, and also so that you don't feel like you need to cut their nails and cut their little hand. Coming in at number 4 is onesies, and this is an optional one. I usually say within the first couple days, even at the first 2 weeks, skin to skin is so amazing. So you want to be able to put the baby directly on you and do as much skin to skin as possible, and there's loads of benefits to it. If you want me to make a video about the benefits of skin to skin, I can make that, but I usually say putting the baby skin to skin on you is the best thing. However, I understand you're going to want to eat, you're going to want to shower, you're going to want to use the restroom, you're going to want to do things. So having some onesies for the baby are very great. Some hospitals feel away if you put clothes on the baby. So some hospitals say you can't dress your baby. I say take this one with a grain of salt. But if your hospital is one where you can dress the baby, and the reason why is because we assess the babies so much during the first 24 hours. But if your hospital is a hospital that allows you to dress the baby, I really recommend the zip up onesies, because with the zip up onesie, you can leave their like little hands in and you could just pop their little feet out and still do skin to skin, and then pop their feet in and zip it right up. You don't have to do all the buttons and button this side and button that side. It's too much. The little zipper ones are great, and they're also great for when you go home for sleep feedings and stuff like that. So highly recommend those onesies if you want to bring them to the hospital, but even if you don't, later on when you go home, they're going to be amazing. Coming in at number 5, if you are a mama who wants to give your baby a pacifier, a lot of hospitals have moved away from providing pacifiers to parents. So highly recommend you bring your own pacifier. You will also need to sanitize your own pacifier because we do not do it at the hospital. So bring your own pacifier, bring it all nice and sanitized. If you plan on giving your baby a pacifier, I understand babies have a strong suck reflex, and so sometimes mamas want to give a pacifier, but just beware that a lot of hospitals have moved away from providing one. So if you want one, don't forget to bring one. Coming in at number 6 is going to be bath soap and hair soap. Usually within the first 24 hours, especially hospitals that are baby friendly, we do not bathe the baby. We really focus on mom and baby bonding, and we don't want to wipe off the vernix and all that different stuff for several reasons. However, eventually you can ask for a bath, or your hospital will provide you a bath after the first 24 hours usually. And so you want to have some type of gentle baby soap that you plan on using even when you go home. Or even if they don't bathe the baby, you probably will want to wash the baby's hair, because there's a lot of like blood and gunk that gets in the baby's hair. So you may just want them to show you how to wash the baby's hair out. So have some type of bath soap or hair soap so that they can help you and assist you with that. So highly recommend that, especially if your hospital gives baths. But even if they don't, at least bringing some baby hair soap so that you can wash the baby's head, because I'm telling you, there will be gunk in it. There will be gunk in it, and at least you could get a little tutorial with the nurses on how to do that. Coming in at number 7 is going to be muslin blankets. I love muslin blankets, and so does the babies. You are going to want to bring washed, make sure they're washed, muslin blankets for the baby, especially if your hospital is one that doesn't allow you to really dress the baby, because you could get the cute little colors and whatever you want that fits your style and your needs, and you can still, the baby can still be you pretty much without any clothes under, but you can do like cute little swaddles, or have your nurses help you with cute little swaddles with the muslin blankets. So it still gives you a sense of like, I want my baby to look a little bit different. You know, I want my baby to have a little style, you know. It still gives you the sense of that. So muslin blankets are great, and they're also very gentle on the baby's skin, because the baby's skin is very sensitive. So sometimes our blankets at the hospital are a little bit rough, and babies may kind of get a little irritated from the roughness of the blankets. So muslins are a great option. If you don't want to do muslins, of course we have blankets at the hospital, but just kind of check with your hospital. I'm sure they have blankets at the hospital, but just kind of check with the hospital, especially going home too. You really want to make sure you have a nice little blanket to go home with. And in the summer, if you're watching this like close to summer, muslin blankets are usually enough to take the baby out of the hospital. Coming in at number 8 is going to be a hat and socks. So babies lose the most heat from their head. So you definitely want to make sure you have a nice little hat for them. We do give you a hat after delivery, but that hat tends to get disgusting. We do have more, and we can give you more, but if you want to add your own little style and your own little flair, do not forget to bring cute little baby hats for the baby. and also socks. They're going to come off because babies can't keep socks on for anything. They're going to come off. However, like I said, the little hands and feet are the last to get perfused, and so they're always cold, the hands and the feet. So you want to kind of cover them up to keep them warm, especially if you're not going to have them on a onesie or something like that. Coming in at number 9 is the outfit you guys have been planning since you probably got pregnant. It is the going home outfit. So we cannot wait to see you guys' little cute going home outfits, especially me as a nurse. I'm like, oh, what is the baby wearing home? Like, I love it. So I usually say whatever going home outfit you're going to do, try to make sure it's like a onesie or some type of shirt and pants, so that when you put the baby into the car seat, the baby's body is still covered, okay? Because just remember, babies should have on one extra layer than we have on. So of course you're gonna put a blanket over them, but you want them to be covered, especially taking them out in this time, in the fall and the winter. Summer, you still want to have them covered, but you could probably get away with it a little bit more. But in the fall and the winter, you definitely want to make sure you have your going home outfit with some type of shirt and pants or onesie or something where you can still strap them into their car seat. Okay? Speaking of car seat, coming in at number 10, you want to make sure you have your car seat, and you also want to make sure you have your infant insert. So you want to make sure that before you even come to the hospital, you get your car seat verified with either the fire department that you installed it correctly, because I cannot tell you how many car seats are installed incorrectly. So you want to make sure that the car seat is installed correctly. Usually the fire department will check your car seat. I am in the US, and that is where we send patients. We send them to the fire department to get their car seats checked. I do not know if you are somewhere else outside of the US. I don't know how it works or where you could go to get your car seat checked, but look into it, because a lot of car seats are installed incorrectly, and that is very important. You want to make sure that it is installed correctly and that you do have it, and you bring it to the hospital before the baby goes home. You do not need to bring it up to labor and delivery. You do not need to bring it up to postpartum unless the nurse tells you your baby needs a car seat test. That's the only reason why you would need to bring it up. We just need to know that you have a car seat to put the baby in when you're going home. And it's usually just a question that we ask. But you want to make sure you have that. You want to make sure it's all secured in the car. You want to make sure it's ready to go, and you also know how to work it. Because nurses do not help you install car seats. We do not help you put the baby inside of the car seat. None of that. You guys are going to have to do it. So just make sure you know how to work it, you know it's installed correctly, and when you come to the hospital, it's already installed, so it's one less thing you have to worry about. Coming in at number 11 is a nursing cover. If you are going to have a lot of friends and family come and visit you at the hospital, a lot of my mamas are like, shoot, I should have brought my nursing cover, and rightfully so. So nursing covers are great. Some of my mamas are like, this is my room. If they're coming in my room, they need to be prepared, and that's totally fine too. Do what's comfortable for you. I just mention it because some people do wish that they had a nursing cover, especially if their father-in-law is coming, or their brother or something. They kind of want to cover up a little bit, and that's totally up to you at your discretion. But I did want to mention it because I do hear a lot of mamas say that they wish they would have brought it, especially if they're going to have a lot of family coming to the hospital to see them and the baby. Coming in at number 12, you are going to want to have a pediatrician already picked out before you come to the hospital. Literally 50% of my patients don't have a pediatrician. And I think it's like, you just don't know that you need one, but you do need one, because once the baby is born, there are things that we need to send to the pediatrician's office. We need to know who they are. We need to know where they're located, their phone number, stuff like that. So you want to just have that all written out before you come into labor and delivery, you want to already know who your pediatrician is going to be. And then you also want to bring like a little baby folder for the baby, because you are going to be getting so many forms for the baby. So you want to be able to have somewhere to securely put them, because some of these forms are important. It tells you what your baby got, what your baby didn't get, all the things. So you want to have a little form and also a little pen along with that, so that you could fill out any paperwork or mark any paperwork that you need to, and everything is nice and secure and taken care of, because you're not going to want to do it when you go home. Trust me. Coming in at number 13, this is for mamas who either do not plan to breastfeed or for mamas who cannot breastfeed for different medical reasons. So you want to have either a formula that you want to be giving your baby, you already want to have the formula that you want, or you want to contact the hospital to see what formula they provide. I say a fed baby is the best baby. Of course, if you want to breastfeed, we're going to support you in that. If you don't, we're going to support you in that. So if you want to feed your baby formula, one of the things that I get the most is that a lot of my mamas are like, I want to feed my baby this formula. You know, I've done extensive research. I went here and there to get the formula. I want to feed my baby this formula. But hospitals have policies and procedures when you're bringing something into the hospital. So you want to make sure if you have a particular formula that you want to give your baby, you get it approved before you get to the hospital, that you could feed your baby that formula. And you're going to be bringing your own formula. You want to make sure you get that approved, because it will not get approved when you get there for labor and delivery, and it also won't get approved when you are there for postpartum. So do that beforehand, before you even go into the hospital. Let them know, hey, I plan to feed my baby formula, and I'm going to bring in my own formula. What paperwork do I need to sign to do that? Or if you are someone who's like, I don't want to breastfeed, or I cannot breastfeed, but I want to give my baby donor breast milk, that is great. You need to ask the hospital, do they offer donor breast milk? Because some hospitals offer donor breast milk and some do not. Some hospitals only offer donor breast milk to babies who are in NICU. So these are the questions that you want to ask before going into the hospital. Coming in at number 14, this is kind of an optional one, and it is the Boppy pillow. Some of my mamas swear by the Boppy pillow, and they say it helps them so much when it comes to breastfeeding, having somewhere to put the baby on the bed, when they're like laying in the bed with the baby, and they just love it. Some of my mamas say it is unnecessary, and these are usually, my mamas who say it's unnecessary are usually my seasoned mamas, where this is not their first baby, this is, you know, their second or third, or you know how it goes. But my first time mamas usually really benefit from a Boppy pillow, because when you're learning how to breastfeed, you don't have the coordination down yet. You don't have the hand skills down yet. And the more support, the better. And a Boppy pillow usually provides you that great support. Again, it's not a necessity, because at the hospital we do provide pillows, and we can give you pillows to kind of simulate that same thing. But if you want to be a little bit more independent, if your partner's going to kind of be in and out while you're there, then a Boppy may be something that you want to bring to the hospital. Number 15 is going to be a heavy blanket. We are currently in the fall season going into the winter season, so you definitely want to bring a heavy blanket so that when you are leaving the hospital, the baby is nice and warm. Also, when you're taking the baby out of the car seat to wherever it is that you're going to be going, inside the house or whatever, the baby's also nice and warm. Remember, the first month is re-simulating utero, what they felt in utero, and they were nice and cozy and warm in utero. So a nice, good, cozy blanket is going to be great when you are moving them from one place to another, out of the hospital into the car, out of the car into the house. Like, it's gonna be a great option, especially in the season that we are in. If you watch this in summer, probably don't need that. You can do without that. A muslin blanket should be fine, but in the fall, winter months, it's definitely gonna come in handy. Okay, you guys, that is everything that I believe that you are going to need for the baby. And if you got value out of this video, please do not forget to like this video, and I would love for you to subscribe. I am going to be doing so many videos about pregnancy, labor and delivery, postpartum, baby care, breastfeeding. So if that is something that you're interested in, do not forget to subscribe. And if you are going to be delivering soon, I am wishing you so much luck, mama. You got this. You can do it. I'm sending lots of love and positivity your way. I really, really hope that this helped you. And if you are going to be delivering, comment below when. I would love for you guys to connect, because it really, really takes a tribe, and this community is for you guys to connect as well. So I will see you guys in my next video. Mwah! Love you. Bye.